This is a very important conversation, a conversation which is very close to my heart, because to me, community health workers, they're the backbone of the health sector. So I'm happy that we are making strides globally, not just Malawi. For Malawi, we have really come from far. In fact, for us community health workers, the way they started as volunteers. We had our first case of outbreak of cholera. That was around 1970s. I think it was 71, 72, 73. And cholera the way it is. When you have cholera, there's vomiting, diarrhea, so it started like just volunteers. I think the communities that time, they had to organize themselves to see how best they could handle the cholera outbreak. So they started like volunteers. It was just communities mobilizing themselves so that they can take care of the sick that time. So from there as volunteers, and then, issues of vaccination started, so now we had the volunteer vaccinators, because now vaccines, they were available globally for cholera, for so many things, around 70s. So now we had vaccinators. But now the current situation is that we have normalized the community health care worker. So in Malawi, we have what we call health surveillance assistants who are community-based. In fact, we make sure that we recruit from the villages. One, we want them to understand the culture of the community. We want them to understand the language of the community. So they should be part of the community. In fact, they are also part of what we call the Area Development Committee, which is under local government. So that all the information, they are part of the community development. So we have the health surveillance assistants, and then of course we also have community nurses in our communities. So now we have regularized, they are civil servants. They get paid all the perks which a civil servant gets. Our community health care worker, they get. They're entitled to a holiday, they're entitled whatever is for a civil servant, so they are part of the civil service. Now, what we're doing, we would recruit like from high school, then they would go under a 12-week training by nurses, by also clinicians. But now the future is that now we have developed a proper curriculum. Because one of the issues that when you are a health surveillance assistant, there was no like career progression. All of us, you need to get somewhere. I'm a minister, I don't even know what I want to be. But I guess I also need, career progression. So it's the same. They need to be motivated. So for that to happen is we have developed a curriculum 1 year. And that was done by the help of our College of Medicine. Because we want, for us, it is important that the doctor, the nurse, and the community health care worker, they're on the same page. They should not be like, you are taking our job, why are you doing this, why are you doing this? No, there is enough work for everybody. So we had our College of Medicine, which developed this curriculum. They're going to do it for 12 months, and from there, at least, they can, be promoted to something else. We have a normal one, then, they can go as far as the Chief Health Surveillance Assistant, in their career progression. We have done that as a way of motivating. So we have about maybe 13,000 in Malawi, which is not enough. Would have loved that, at least we have one community health care worker for at least 1,000 people. But now that is not the case. We still need more. Malawi, our population is about 20 million as we are talking right now. So we need more. So it means I'm already talking of the challenges that they are not enough in the community. The other issue maybe which I can also talk about is about to motivate them to do their work better. So it means they need to have equipment, they need to mobility as well, because most of them, we make sure that they live in the hard-to-reach areas, areas where really it is very difficult. The road network is very difficult, but they have to work there. So as government now, we are saying, okay, what is it that we have to do to make sure that, we support them wherever they are. So with the help of our partners, and we are very, very grateful to our partners, so many of them, to mention Global Fund, you mentioned, we work with UNICEF, WHO, with the help of our partners, at least we have been providing motorbikes, in other cases even motorcycles as well, for them, the backpacks, each and everyone, they have a tablet, each and everyone, they have a phone. With the help of our local service providers, they have also given them the MiFi to make sure that they are connected. So, and since last month, we have integrated more services. Mainly they do preventive and promotive health, which is very, very important. Because I was telling my Honorable Minister of Finance, I said, if you think prevention is expensive, try getting sick. Sick is so expensive. It is so costly for one to get sick.